Hi, my name is Dr. Madison. I'm an ENT surgeon based in Abuja, Nigeria. And today I'm going to talk about children, babies, infants with ear infections. And you'll wonder, how did this little child get an ear infection? It's due to the way their ears are. You know, when we think of the ears, we think of this thing outside, but actually, the ear is made of many different parts. And there's this part we call the middle ear. It has a tube that connects it to somewhere at the back of the nose. And in children, this tube, that's this, see it in an adult, called the eustachian tube, is short, it's wide, and it's open. And it opens up somewhere behind the nose. So infection from the nose and the area around the nose easily spreads up to the ear. So babies tend to have this a lot from infections in the nose. So if a baby catches a cold, all it needs to do is just climb up through the nose, through the eustachian tube to the ear, and the child has an ear infection. So if your baby is colicky, should I use that word? If your baby is crying, feverish, touching the ear, not allowing you touch the ear, irritable, not eating or anything, ask the pediatrician to check the ear. The child might just have an ear infection. It's not always malaria. But then you now ask, how can we prevent this? One thing we ask is, don't feed your baby lying down. If you need to feed your baby, sit up at night and breastfeed your baby. Even if it's a bottle, sit up and raise the baby's head. The reason is that if you lie flat, it's easier for milk to wash into the middle ear and wash any bacteria at all in the middle ear into through the eustachian tube into the middle ear and cause infections there. Sometimes the infection just presents with fever, pain that the baby cannot explain. They're actually too young. But other times it will actually cause discharge from the ear. Once the discharge is drawing, mucoid, please, please, please run and see your ENT consultant. Have a good day.